Have you ever thought about those really persistent bone infections? The kind that just seem to hang on no matter what.
Yeah, despite antibiotics, even surgery sometimes, it's a real challenge.
Makes you wonder, if there's something else. And today we're looking at a pretty interesting idea, hyperbaric oxygen therapy.
Uh-huh. Using pure oxygen, but under increased pressure.
The basic thought being maybe flooding the body with all that extra oxygen could overcome why these infections are so hard to treat in the first place, like problems with blood flow or healing.
Exactly. So this deep dive is focused squarely on that. Hyperbaric oxygen therapy for what's called refractory osteomyelitis.
Refractory meaning.
Hmm.
It just hasn't responded to the usual stuff.
Precisely. The standard treatments haven't worked. Persistent bone infection.
And for you listening, especially if you like getting to the bottom of complex topics without getting bogged down, we know how frustrating treatment resistance can be.
Right.
So our aim today is to explore this therapy, hyperbaric oxygen, in a way that's clear and, well, easy to follow.
We're pulling from, foundational knowledge in hyperbaric medicine, the physics, how it affects the body, the clinical side of things, solid background info.
Our mission then is to really understand the why. Why use hyperbaric oxygen for these really stubborn bone infections that just won't clear up?
Okay, sounds good.
So let me start at the beginning. What makes osteomyelitis, this bone infection, so difficult to handle generally? What's the core issue?
Well, osteomyelitis is fundamentally an infection inside the bone. The tricky part is the bone itself.
How so?
Compared to other tissues, bone doesn't have a fantastic blood supply. It's relatively limited.
Okay, so getting things to the infection is hard.
Exactly. It makes it tougher for antibiotics in your bloodstream to reach the site in high enough concentrations. Same goes for your body's own immune cells.
And when you say refractory osteomyelitis,
That's when, even after, long courses of antibiotics, maybe even surgery to clean out the infected bone, the infection just stays. It persists.
so the usual toolkit isn't quite enough. Which brings us to hyperbaric oxygen. It sounds pretty high-tech. Can you break down the basic science? How does pressure plus oxygen make a difference?
Sure. To get how these hyperbaric chambers work, we have to touch on a bit of basic gas physics.
Right.
You've got laws like Boyle-Marriott's law, which basically says keep the temperature the same, and as you increase the pressure on a gas, its volume shrinks.
Right. Pressure up, volume down.
And then there's Charles or Gay-Lussac's law, keep the pressure constant, and as temperature goes up, the volume of the gas expands. These principles govern how gases behave under pressure in the chamber.
So inside the chamber, the pressure is higher than normal atmospheric pressure. What happens when a patient breathes pure oxygen in there?
That's the key step. When you breathe 100% oxygen at, say, 2 or 3 times normal atmospheric pressure, something important happens.
Which is?
You dramatically increase the amount of oxygen that dissolves directly into the liquid part of your blood, the plasma.
Not just what's carried by the red blood cells.
Exactly. Normally, hemoglobin in red blood cells carries almost all the oxygen. But under pressure, you force much more oxygen to dissolve straight into the plasma itself.
Okay, so the blood essentially becomes super-oxygenated.
Yeah.
How does that help with a stubborn bone infection down in the tissue?
Well, this is where the physiological effects really kick in. Because there's so much more oxygen dissolved in the plasma, it can reach tissues much more effectively.
Even those poorly supplied areas in the bone we talked about.
Especially those areas, the high concentration gradient helps drive oxygen from the blood into the surrounding tissue, even if the capillaries, the tiny blood vessels, aren't working perfectly or are scarce.
That makes intuitive sense. If the infection's hiding out where blood flow is bad, this is like a backdoor for oxygen delivery.
Sort of, yeah. It bypasses some of the usual limitations.
Now, you mentioned bone infections often create low oxygen environments, hypoxia, right?
Right.
I seem to recall some concern that just flooding a hypoxic area with oxygen could potentially cause other problems, like oxidative stress. Is that something to worry about here?
That's a really astute point. Yes, infections often lead to hypoxia. And hypoxia itself isn't good for healing. It can hinder cell function. And there is a theoretical concern about generating more reactive oxygen species, sometimes called free radicals, if you suddenly introduce a lot of oxygen.
So is it a trade-off?
Well, the body does have natural defenses against that kind of damage. Antioxidants like vitamin C, vitamin E, enzymes like glutathione peroxidase, they're there to manage oxidative stress. And the pressures used in hypobaric therapy are carefully controlled.
Okay, so the body has countermeasures. Let's shift focus to the bugs themselves, the bacteria causing the infection. What does this high oxygen environment do to them?
It's interesting. High oxygen levels can actually be toxic or inhibit the growth of certain bacteria, particularly anaerobic bacteria, the ones that thrive without oxygen.
And those can be involved in bone infections.
They can be part of the picture, yes. For example, an antibiotic like metronidazole works best in low oxygen conditions and basically stops working when there's plenty of oxygen around.
But what about the more common bacteria, like the aerobic ones?
Well, maybe even more importantly, the increased oxygen pressure seems to boost the effectiveness of certain antibiotics against common culprits in osteomyelitis, like Pseudomonas aeruginosa.
Oh, really? How does that work?
Studies have shown that under hyperbaric conditions, high oxygen, some antibiotics like tobramycin or amikacin actually kill bacteria like Pseudomonas more effectively. They show what's called an increased post-antibiotic effect.
Meaning they keep working longer, even after the drug level drops.
That seems to be the case, yes. So you potentially get a double whammy, more oxygen reaching the site,
Yeah.
and the antibiotics working better when they get there.
That's a powerful combination. But osteomyelitis isn't just about killing bacteria, right? The bone itself is damaged. It needs to heal.
Absolutely. Critical point. Healing requires energy, and it requires building blocks.
Yeah.
And oxygen is fundamental for the cellular processes involved in repair.
Like what, for example?
Well, think about collagen. It's the main protein in connective tissue, essential for rebuilding bone structure. The cells that make collagen are called fibroblasts.
Right.
And research, including lab studies, shows that providing more oxygen stimulates these fibroblasts. They tend to multiply more and produce more collagen when oxygen levels are higher.
So more oxygen, more building material for repair. What a
Oxygen is also vital for angiogenesis.
angiogenesis. That's the growth of new blood vessels.
Correct. To heal properly, especially in damaged tissue, you need to restore blood supply. New capillaries need to grow into the area to bring nutrients, oxygen, and immune cells.
And oxygen helps that process.
Yes. And interestingly, these new vessels need support from the surrounding tissue, including those fibroblasts we just mentioned. It's all interconnected.
It sounds like hyperbaric oxygen might be sort of kickstarting the body's own repair systems.
That's a good way to put it. Some researchers describe hyperbaric oxygen as acting almost like a drug, initiating signaling cascades that promote healing. These effects can even continue after the treatment session ends.
How?
It might involve activating specific pathways, like those involving proteins called hypoxia-inducible factor 1, or HIF1, and vascular endothelial growth factor, VEGF. These are known players in stimulating new blood vessel formation or neovascularization.
Wow, so it's potentially triggering some long-term repair signals. Okay, we've got oxygen delivery hitting bacteria, boosting collagen in blood vessels. What about inflammation and swelling? That's usually a big part of infection.
Right, edema or swelling can be a problem. It increases pressure in the tissues and can further compromise blood flow and oxygen delivery.
Does hyperbaric oxygen affect that?
It can. One effect of hyperbaric oxygen is vasoconstriction, a narrowing of blood vessels.
Wait, wouldn't that reduce blood flow?
In healthy tissues, yes, it causes mild vasoconstriction. But in an area that's already inflamed and swollen with leaky vessels, this effect in the surrounding healthier vessels can actually help reduce the overall edema, the fluid buildup.
Ah, I see. By slightly tightening the healthy pipes nearby, it reduces the overall leakage and swelling in the damaged area.
That's the thinking. Less swelling can improve microcirculation and make it easier for oxygen to diffuse into the infected tissues.
Okay. And one last piece, that the bone itself. Does it help actually form new bone?
There is evidence suggesting that yes, hyperbaric oxygen therapy seems to enhance osteogenesis.
Osteogenesis, bone creation.
Right, the process of laying down new bone material, which is obviously crucial for fully healing a bone infection.
So, looking at the whole picture, hyperbaric oxygen seems to tackle refractory osteomyelitis from, well, a lot of different angles.
It does. It addresses the oxygen deficit, potentially enhances antibiotic action, seems to inhibit some bacteria directly, promotes key healing processes like collagen synthesis and angiogenesis, helps reduce edema, and may even stimulate new bone formation.
That's quite a list. It really paints a picture of why it might be useful for these infections that are otherwise so hard to beat.
Yeah.
Okay, let's get practical. What's the actual experience like? What kind of chambers are used?
There are basically two main types of hyperbaric chambers, monoplace and multiplace.
One place sounds like one person.
Exactly. It's usually a clear acrylic cylinder. The patient lies inside, and the entire chamber is pressurized with 100% oxygen. So you're breathing the pure oxygen directly from the chamber environment.
Okay. And multiplace.
Multiplace chambers are larger, like a room, that can hold several patients, and often a medical attendant, too. The chamber itself is pressurized with regular compressed air.
So how do the patients get the pure oxygen then?
They breathe it through a mask or sometimes a special hood system.
Are there pros and cons between the two, specifically for treating something like osteomyelitis?
While monoplace chambers are often less expensive to install and can sometimes use a hospital's existing oxygen infrastructure, being clear, they allow for easy visual monitoring, which some patients find reassuring.
Can you monitor patients closely inside, especially if you're quite sick?
Yes, that's a key advantage, particularly of modern monoplace chambers. You can get specialized equipment, IV pumps, even ventilators that are designed to work safely under pressure.
So you could treat someone who's critically ill.
Potentially, yes. You can monitor heart activity, blood pressure continuously. With the right setup and experienced staff, you can even do things like monitor arterial blood pressure or draw blood gas samples through ports in the chamber wall.
That level of monitoring sounds really important for complex infection cases.
It can be, absolutely. Though it's worth noting that the experience level in managing very critical patients in hyperbaric settings might vary between facilities.
Right, so this therapy, hyperbaric oxygen, it really presents a multifaceted strategy against a very difficult medical problem.
It does.
And for you listening, hopefully you got a clearer picture now of the science behind it, how it aims to overcome the challenges of these persistent bone infections.
We've seen it's not just about pumping in oxygen, but how that extra oxygen, delivered under pressure, can trigger a whole cascade of beneficial effects. Cellular, molecular, tackling the core reasons these infections are so stubborn.
And while we didn't dive deep into specific clinical trial results for refractory osteomyelitis today, understanding these mechanisms really lays the groundwork for why it's being used, why it's being explored for these tough cases.
Yeah, absolutely. And I imagine this overview probably sparks more questions for you. You might be thinking, okay, what are the actual success rates? How often do people need treatment? What are the long-term results?
Exactly.
Yeah.
All very important questions. And that brings us neatly to our final thought for you to ponder.
Okay.
Given all these complex ways hyperbaric oxygen interacts with the body, with the infection, with the healing process in bone, what are the really critical research questions we still need to answer to fully nail down its role in treating persistent osteomyelitis? And perhaps more importantly, how do we translate that deeper understanding into even better, more targeted treatment strategies for those people who haven't found relief through the standard routes?
That's the crucial next step, isn't it? Figuring out how to best utilize this tool for those who need it most. A really compelling area for future work.